This is Barry Zalma on Insurance on YouTube. I am an attorney who has retired from the practice of law. I still work full-time as an insurance claims consultant, an insurance expert witness, an author, and producer of these videos. Today, we speak about the sick building syndrome. Sick building syndrome, SBS, covers the whole range of health problems that are related to toxic or toxin exposure in a building. There are serious questions raised by physicians and mold experts about the existence of a true relationship between the mold and bacterial infections that have been reported to be the cause of SBS. SBS is used to describe situations in which building occupants experience acute health and discomfort effects that appear to be linked to time spent in a building, but no specific illness or cause can be identified. The complaints may be localized in a particular room or zone, or may be widespread throughout the building. In contrast, the term building-related illness, BRI, is used when symptoms of diagnosable illness are identified and can be attributed directly to airborne building contaminants. The causes of the sick building syndrome are not easily identified, and there are more than one such causes. The most frequently alleged causes are toxic fumes, bacteria growth, toxic gases, fungal spores, and the so-called toxic mold. In some cases, building occupants complain of symptoms associated with acute discomfort, such as headaches, eye, nose, or throat irritation, dry cough, dry or itchy skin, dizziness and nausea, difficulty in concentrating, fatigue, sensitivity to odors and nosebleeds, shortness of breath and or exhaustion after minor exercises such as walking, a burning and watering of the eyes and nose, hoarse and sore throat, and heart palpitations. The toxins in certain molds have been suggested to be a medium that triggers asthma attacks to certain people sensitive to mold. The toxins may also act as irritants and can exacerbate asthma in otherwise non-sensitive people. Hypersensitivity pneumonitis has also been linked to both short and long-term exposure to molds. It may develop following either short-term acute or long-term chronic exposure to molds. The disease resembles bacterial pneumonia and is uncommon. It also seems to resemble the effects of viruses such as the COVID-19 virus. People also suffer from pulmonary hemosiderosis, a lung disorder that occurs in infants and children, which causes bleeding in the lungs. The disease is rare and the cause is unknown. Other SBS diseases might be considered idiopathic pulmonary hemosiderosis, IPH or AIPH, most common in young children, but can occur in adults. Pulmonary hemorrhages are most often mild and continuous, but can be severe. Blood in interstitial spaces leads to pulmonary fibrosis. Patients may live for several years developing pulmonary fibrosis and insufficiency with chronic secondary anemia. Some commentators have suggested the disease may be caused by exposure to mycotoxins produced by Stachybotrys chartarum or other fungi growing in moist household environments. The U.S. Centers for Disease Control and Prevention report, quote, overall, the evidence from these studies was not of sufficient quality to support an association between Stachybotrys and AIPH. In addition, the reviewers noted that evidence from other sources supporting a causal role of Stachybotrys in AIPH is limited. First, AIPH is not consistent with historic accounts of animal and human illnesses caused by Stachybotrys or related toxigenic fungi. A related study concluded that Stachybotrys produces the mycotoxin tetrodotoxin H, which is implicated in very high cytotoxicity and several environmental allergic reactions. The various papers concerning the toxicity of contact with mold spores has met with serious concerns that people can really be sickened by exposure to mold spores. Many experts believe that is not possible. One major disease function that is included within the sick building syndrome is Legionnaires Disease, which acquired its name in 1976 when an outbreak of what was believed to be pneumonia occurred among persons attending a convention of the American Legion in Philadelphia. Later, the bacterium causing the illness was named Legionella. Patients with Legionnaires disease usually have fever, chills, and a cough, which may be dry or may produce sputum. Some patients also have muscle aches, headaches, tiredness, loss of appetite, and occasionally diarrhea. Laboratory tests may show that the patient's kidneys are not functioning properly. Chest x-rays often lead to a diagnosis of pneumonia. It is difficult to distinguish Legionnaires' disease from other types of pneumonia by symptoms alone. Other tests are required for diagnosis. Legionellosis is an infection caused by the bacterium Legionella pneumophila. The disease has two distinct forms. Legionnaires' disease, the most severe form of infection that includes as a result of the infection the development of pneumonia and Pontiac fever, a milder illness. The bacteria that causes Legionnaires' disease thrives where there is a lack of moisture control in air conditioning systems. There are approximately 35 Legionella variations known to produce the disease, which can survive for several months in a wet environment and multiply in the presence of algae or other organic material. In Amco Insurance versus Swagat Group, the issue of liability for the disease was discussed in detail, and depending on the causes found, the applicability of insurance exclusions. Legionnaires' disease is a direct result of the following construction defects: defective air conditioner materials, including insufficient splash bars, cooling towers, or evaporative condensers containing Legionella or other microorganisms brought in by circulating air or water, a break between the air conditioning system ducts and those of the cooling tower, improper installation of an air conditioner, defective repairs to air conditioners, or existence of standing water in a structure, or even a design defect that allows moisture droplets to enter the structure. Outbreaks of Legionellosis occur when mists are inhaled from a water source such as air conditioning, cooling towers, whirlpools, spas, showers contaminated with Legionella bacteria. In Methodist Hospital of Indiana versus Ray, a 1990 Court of Appeal decision, a patient contracted Legionnaires disease while hospitalized. Ray claimed that during his hospitalization to have a kidney stone removed, the hospital negligently and carelessly caused and permitted its premises to become infested and infected with the deadly Legionella pneumonia bacteria. The court, based on Indiana statutes, refused to allow the case to go forward, although it indicated that discovery might provide facts to establish a basis to maintain the suit. This video was adapted from my book, Construction, Defect, and Insurance, Volume 2 of 8, and is available both as a Kindle book and as a paperback from Amazon.com or from my website, Zalma.com, by clicking on the link to the insurance claims library and then searching down for construction defect and insurance. If you found this video to be of interest or use to you in your profession, please tell your friends and subscribe to the YouTube channel. Thank you again for your attention.